Radio Free 102.3 KJLH. Good morning. It's Dominique DiPrima, and I'm so pleased to have some really powerful folks in the mental health and the public health space and in our elected official realm to give us some really solid and important information right now around COVID-19. Supervisor Mark Ridley-Thomas, who, as you know, is a longtime community organizer, former council member in the 8th District, and the supervisor for the 2nd District, has convened an incredible panel for us. Good morning, Supervisor Ridley-Thomas.
Well, good morning to you. Delighted to be here per usual.
We've heard a lot, of talk, obviously, about the coronavirus and COVID-19. There is a lot of misinformation going around. And you and I talked about this. Why did you think this particular group of people would be so important to talk to our front page family?
Well, first and foremost, Dominic, I want to say thank you for representing. I've monitored the station's efforts at making sure the community is informed, and you've done an exemplary job, and I want to give that shout out early on to the entire station. Shout out to Stevie and all of the crew, to Andre. We are blessed to have you, but we're equally blessed to have top flight physicians, healthcare experts, as well as academics who know, live, and have walked the journey of the experience of being African American and serving broader constituencies. And they are those that have been kind enough to join us this morning to lend their insights and their expertise. They are affiliated in one form or another with the County of Los Angeles, and we're proud to have them as a part of our efforts to make sure that we impart accurate, culturally sensitive, and culturally competent information for the good of all people in the County of Los Angeles and beyond.
Indeed, and I want to, just go through our panel here and kind of have you introduce them a little bit more in depth. We have LA County's Health Officer, Dr. Muntu Davis. Would you introduce Dr. Davis, please?
Well, Dr. Davis is an exceptional physician practitioner, and he is the health officer for the County of Los Angeles. Comes from Los Angeles, spent some time in Oakland working in a similar capacity, but more expanded in many respects roles here because this is a much larger footprint. Trained both at UCLA Medical School, did an MPH at Harvard, and is doing a fantastic job as our health officer. Been here with us in the County of Los Angeles in that formal capacity just over a year, if my memory serves me correctly, but it's a really good thing to have him working in that role.
Welcome, Dr. Davis. Dr. Anissa Davis from the city of Long Beach shouted you out just the other day on the front page as being one of the few African Americans in the prominent position that you hold in LA County. So it's truly a pleasure to meet you.
Thank you very much. Appreciate being here, and hope we can get some good information out there for the public, and I know they're starving for it.
Yeah, so I guess as we bring in each person, I want to at least ask one question. So, Dr. Davis, the really basic question, what is COVID-19? I mean, in the most basic sense.
In the most basic of senses, this is a virus. It's a respiratory virus, much like influenza in terms of how it's transmitted. Ill people getting others infected through a cough or a sneeze, or someone picking up the virus that's been on a surface after an ill person has been in that realm. And so this is really, a respiratory illness, or, again, just like influenza, but it is something that we haven't seen this particular virus infecting humans in the past.
Okay, next we would like to Curley Bonds, psychiatrist, chief medical officer for LA County Department of Mental Health. Supervisor Ridley-Thomas, tell us about Dr. Bonds.
Well, Dr. Bonds has been a mainstay in Los Angeles and has a wealth of experience and networks throughout our community. Trained as a psychiatrist and has done a really step-up job in the County of Los Angeles Mental Health Department, working directly with Dr. John Sharon. He knows what it means for people to experience trauma, to experience stress, distress, and a range of maladies that can beset people under circumstances such as this. And so I thought it would be extremely useful for him to help settle my nerves this morning. Thank you.
Maybe Dr. Bonds, you can settle mine also. Also former chair of psychiatry and human behavior at Charles Drew University of Medicine. I think we're just now starting to really hear about the mental health part and mental health impact of this pandemic. And my non-professional opinion is that in the next few weeks we're going to see it a lot more as this thing drags on. What's the number one thing on your list for folks to do in dealing with this?
Well, thanks, Dominique, and also to the supervisor for inviting mental health to the table this morning. I would say that the biggest problem that everybody is experiencing collectively as a community is just a lot of anxiety, and in this case, fear. Whereas anxiety is non-specific, fear is very specific, and we're all focused on the fear that we have about possibly contracting this illness and what its impact might be on our health.
Yeah, and why is that problematic? I mean, other than the fact that it's not fun.
Well, stress is normal as a response to fear, and our bodies and brains react to this stress very differently. A lot of people of color tend to somaticize. That means you have experiences in your body. So for a lot of people, we're walking around, and every time we get a little sniffle or a cough or maybe a fast heartbeat, we think we might have it. This is entirely normal. You may be also experiencing some other emotions as more and more people are impacted by COVID. There's a sense of sadness, for some people feelings of loss or grief, and I think on an ongoing level, a fear of personal safety. So this pandemic has really been traumatic, like you mentioned, and it's generating all types of responses. And these responses can be either positive or negative. Just real briefly, negative responses can be getting misinformation, trolling the internet, or over-reliance on alcohol or substances. But there are some positive responses that maybe we can talk about later on.
Excellent. I love that. We haven't talked about that much at all in terms of positive responses. Supervisor Mark Ridley-Thomas, thank you so much for putting together this incredible panel. We also have Dr. Deborah Prothrow-Stith, the Dean of College of Medicine at Charles Drew University, DMU. What can you tell us by way of introduction about Dr. Prothrow-Stith?
A clear star among stars. Dominique, you have a star-studded panel this morning, and
yes,
it's already
indeed.
revealing itself. Dr. Prothrow-Stith is the dean, as you indicated, of the School of College of Medicine at the university, Drew University of Medicine and Science, and has done a tremendous amount of work as an internist, someone who has been clear in terms of her work, in terms of public policy, served in capacity at Harvard as the Assistant Dean of Diversity. In addition to that, was appointed the Dean of, not the Dean, but the Commissioner of Public Health by then Governor Michael Dukakis. Has been for the past several years, practically 5, I suspect. She's short of that now in Los Angeles, coming from that cold weather. Everybody tries to get to Los Angeles for a reason. For wonderful reason. There's a lot happening in Los Angeles. Dr. Davis started, he wanted to stay out of Los Angeles, but he found his way back. Dr. Bonds, did you ever stray away? Did you ever stray away, Dr. Bonds?
I've been in the cold, too. I was in Indiana for medical school.
So this is the place where physicians who want to be warm find themselves. And so Dr. is here doing a tremendous work with those students, and it's a source of pride and fulfillment that she's here working with us along with Dr. David Carlisle, the president of the university, and the whole team there. And so Drew is on the case, and I thought it would be important to have academic medicine as a part of this discussion, particularly as it relates to serving the underserved and having those who are being trained for the future in terms of medicine to be a part of our conversation.
Thank you so much for joining us. I feel like we're hearing so much about just doctors and hospitals and stuff being overwhelmed, the entire that we have. And, these are part of what make us scared. What role, is Drew CVU playing in this whole big picture?
Well, again, thank you for having me, and the supervisor for those warm remarks introducing me. It is truly a pleasure to be on the front page, so thank you. This is a very, very challenging time, and certainly for the university as we train the future nurses and physicians and public health workers. We are doing our best to not only use the very practical advice, safer at home, washing hands, taking care of ourselves, but training our future providers on the COVID-19, on the pandemic, and on the ways to take care of the patients that they will see. So the university is very active, participating in community coalitions and addressing some of the disparities that are in our healthcare system that are playing out in the pandemic as well.
And Supervisor Ridley-Thomas, that's been one of your, things is championing, us at the level of the county so that those disparities don't impact us the way that they otherwise could. It's great to know we have all these amazing folks working on our behalf. Talk about some of the things that are being done, to, I guess, flatten the curve of disparities, if you would.
Well, this is an important thing, but it's really important early on to establish, if we can, the impacts of COVID-19 as it relates to the African-American community. And I'm going to ask our panel if they could weigh in on that in terms of any data that is currently circulating that could clarify that, because we need to speak directly to the issue of disparity in this regard and what resources are being marshaled to flatten the curve. But when you flatten the curve, we want to speak to that in terms of equity across all ethnic communities, and whatever data we can talk about where it is impacting more in one space than the other, I think would be useful to the public to know about and to appreciate. Dr. Davis, Dr. Prothrow-Stith, Dr. Bonds, help us on that.
Sure, I guess I can start. This is Dr. Davis. Much like what we see with influenza, this is one of those diseases that can infect anyone, regardless of race or ethnicity. And I think as a result of that, at least up to this point, the Center for Disease Control, much like with influenza, hasn't broken things down by race, ethnicity, because again, this is a new virus and anyone, can be infected by it and get sick from it. As it's not been seen, in infecting people before. I do think, what we've looked at least in terms of the data, has really been who's more by age group predominantly infected. And so you have roughly about 1 in 3 people between the ages of 18 and 40, and about 1 in 3 between the ages of 41 and 65, and 1 in 5 over 65 being infected with this disease. And so it actually cuts across all age groups. But at least up to this point, I haven't seen any data broken down by race, ethnicity. But again, this is a new virus infecting people, and anyone is prone to being ill by it inside of the county. It's actually cutting across all of our regions.
And to the extent that we don't see, some neighborhoods, do you think this may also be because we're just getting tested? I mean, it seems like even, right now, are we even getting a clear picture of who really has this virus and what communities are impacted when the testing has been so limited so far?
I think that's one of the major weaknesses of the U.S. response to date, as noted by many, is the failure to use basic epidemiology and testing to understand exactly what we're dealing with. But we do know that it does cut across race lines, it cuts across age lines, and it is really important to get that message out. I'd echo the concern that, we heard that young people weren't vulnerable, that Black people weren't vulnerable, and people making jokes about not being vulnerable. And in reality, even among those who are dying from this, though age is a factor to have a higher rate of death, you have younger people, and you certainly have African Americans. There's a very disturbing piece out of Milwaukee that of the 8 deaths that they have had, they've had 411 cases. Of the 8 deaths, all of them were African American, and 7 of them lived in the city of Milwaukee. So we do need to get the word out. Thanks to the supervisor and to you, we need to get the celebrities getting the word out so that we're not panicking, but we're dealing with this.
Yeah,
from a mental health.
Oh, go ahead, please. Yes, Dr. Bond.
Oh, from a mental health standpoint, I would say that one of the challenges is that the African American community already has, I would say, disproportionate levels of certain mental health problems, trauma being among them. We know that there's a lot of attention about interactions with criminal justice. We can have high rates of urban violence because some of the communities have poverty. There's domestic abuse that can happen, and these assaults take a toll on a daily basis just during regular times, but during this period, that's sort of compounded by the homelessness and incarceration. All of these things add to the trauma that make it difficult for people to recover and also to be educated about this. There's this notion that chronic health conditions put people at greater risk, and what you hear about are diabetes and hypertension, but I would say that mental health conditions can also be one of the risk factors because we have people who are experiencing homelessness, who are unsheltered, and that's something where I would say that both the County of Los Angeles and the city have stepped up to the plate to make sure that those who are the most vulnerable have access to secure, safe housing, because you can't shelter in place if you don't have a home. So I think the communities are really going to need to effectively accept that you might have to have folks near you, and they're to protect both them and to protect the community as well.
And speaking of that, I mean, Dr. Muntu Davis, whether you just use logic, you say, well, if it is more impactful on people with diabetes or high blood sugar, high blood pressure, those numbers tend to be high in our community, compromised immune systems. It seems to me that logically we would need to jump into action to protect the African American community and particularly seniors, but across the board where we see high numbers of those issues, right?
Yeah, that is very true, and it is what we would say. We want everybody to just think about logically where you would be at risk. Where there are more higher rates of chronic disease, and take those precautions. And actually, if you get sick, to really contact your doctor earlier, especially if you're feeling worse, in order to be evaluated, not just specifically for testing, but just to make sure that you have what you need, and if you need to be hospitalized, that you can get in there sooner rather than later.
And the protocol is call the doctor first, right? Don't just rush to the emergency room. and then get evaluated. And if you are going to go to an emergency room, they going to want to know in advance that you think you have coronavirus. Is that correct?
That is correct. What they want to do is make sure that they put whatever measures in place, whether it's giving you a mask if you're coughing so that you don't get others sick, or that they do what they need to do in order to protect themselves as healthcare workers and frontline registration staff before you come in. And in some instances, they may be able to talk you through your symptoms over the phone, and you don't need to go in to be evaluated. So you have options, and we're trying to reduce people coming in contact with those who are sick. That's what the basic principle of this is.
So, Supervisor Mark Ridley-Thomas, we're having this conversation about all of these issues that are coming up in connection with COVID-19. And I wonder if you can draw a line in, connect the dots for us as to how this, manifests as policy, because, stay-at-home orders, work-from-home orders, some folks don't want to follow. Some people feel that it's, an erosion of our rights or somehow just an inconvenience. And so I'm wondering if you can connect the dots from what our doctors are telling us to how that's manifesting in county policy with the, safer at home orders.
Well, absolutely. And the reason for this panel is to kind of translate the policies that the board adopts into practical living on the one hand, and in terms of the clinical dimensions of it. So one of the things I wanted to say early on, Dominique, is that if someone is feeling at risk, they should call 211, get the protocol to follow, and the referrals can be made as to what to do in real time. A whole new group of people have been retained to do that. Many of them would have been trained by the Department of Public Health, so they know what they're doing. That's a readily available resource, and people should take full advantage of it. Dr. Davis has the unique responsibility in thinking for it because he issues the orders. For example, that beaches and trails and parks are to be closed. That comes from the health officer of the County of Los Angeles, who has the authority to make those decisions in consultation with his chain of command. Ultimately, it rests at the level of supervisors. And we know that these are important decisions, but the basic responsibility of government is safety, public safety, public health, etc. And so we have to, from a policy perspective, follow the best science. We have to follow the best set of procedures, and at the same time respect the rights of the public in every way possible, from the vantage point of gender, of age, of ethnicity, non-discriminatory policies, but to move this forward in a progressive way that we are doing everything we can to protect the health of our respective communities. That's the sensibility from a policy perspective that the Board of Supervisors is bringing to bear. And we're not doing it narrowly. That's why we have the insights of those who work in the field of mental health, those who are crunching this data from an academic perspective and doing a lot of research and the like. In addition to that, those who are doing the frontline work in terms of public health. This has been an unusually demanding set of circumstances, but the policy agenda is moving forward. And on this, and then when we have our meetings, the board, the policies will be spoken to specifically, and that's Tuesdays at 9:30. We try to make sure that these various aspects of this increasingly complex issue are made plain to the public through that thing.
All right, when we get
I
back...
should say that can only happen virtually at this point.
Yes, indeed.
They can only happen virtually.
Well, we're practicing social distancing on this broadcast, so unfortunately I can't see any of your faces in person, but it's so great to have Dr. Deborah Prothrow-Stith, Dr. Curley Bonds, and Dr. Muntu Davis, along with Supervisor Mark Ridley-Thomas, and we will be right back with some resources. We'll be right back with more insight about this coronavirus pandemic, how it's affecting LA County specifically, and what we can all do to stop it. We are broadcasting live from the KJLH 1-800-THE-LAW 2 studio, Radio Free 102.3 KJLH.